So, good afternoon. I think it's afternoon. Yeah, not quite. What a gorgeous day. Today, we're really excited to announce a new step that the Seattle Fire Department is taking for a healthier downtown Seattle with the creation of a new pilot program that for right now we're calling Health One. I have to say that we will have a team of specially trained Seattle Fire Department firefighters and civilian specialists. Will help people downtown with non-emergency 911 calls for issues like substance abuse, non-emergency medical issues, and need to access services, including people experiencing homelessness. This new pilot program will appropriately address and meet the needs of individuals with non-emergency 911 requests in and around downtown Seattle. As our city grows, we know that our ability to deliver non-emergency responses has to grow with that city. And I know all of you think that I believe everything good was invented in Seattle, but we were the city that pioneered Medic One, which became the gold standard in emergency care in cities throughout the country. We know that non-emergency needs a similar level of response in our growing urban environment. And we are trying this pilot to see if perhaps that might be the next step in urban response. It really allows us the ability to respond to our most vulnerable residents while also making sure that our taxpayer dollars are being spent efficiently and that we're reserving our emergency responses for true emergencies. We want our fire engines and our medics to show up at those life-saving critical incidents. This will give us the ability to make sure that we have a good response for those non-emergency responses, to be able to connect people, sometimes with healthcare, sometimes with our case manager, sometimes with an emergency response if it's deemed that way. I can't say enough about the Seattle Fire Department and the way it has responded in the last years as we have grown as a city. We have seen our city grow by over 100,000 people, and yet our fire department is almost as lean as it was when that growth started. They are working every day to keep our city safe, to respond to emergencies, everything from fires to heart attacks to what happens day to day throughout the city. We're seeing those emergency responses many times don't need an emergency response, and that if we can have a way to deal with the low acuity calls that we're getting in a humane way to connect people to services, to get them the services they need, we will serve them better and we will free up those resources of our fire department for what they needed. I want to thank the fire department. I particularly want to thank Kenny Stewart and Local 27 who came forward saying, how do we as firefighters get smarter, get better, have different responses? This program, I think, is really a pilot that if it goes right, we may see this as the new urban response to non-emergency responses. I also want to thank Councilmember Sally Bagshaw, who could not be here. She's been instrumental in helping us form a response for those low acuity calls and what can we do better as a city to make sure we have the right response to meet people where they are, but also don't tie up our most expensive, our most trained people in those responses. I, of course, have to thank the Chief Scoggins, who is always a visionary on how this department can be better, be smarter, provide services to the residents and businesses of Seattle, and yet do it in a way that's smart as possible. So I couldn't be more proud of the people standing with me today, Councilmember Bagshaw and the rest of the council who supported this project. And with that, I'm going to turn over to our chief.
Thank you,
Thank
Mayor.
you, Chief.
Thank you. Well, good morning. You know, today's an exciting day because we've reached a bit of a milestone in the development of this program, this mobile integrated health program that will be called Health One. And we're excited about that because as we know as firefighters, we have become a part of America's healthcare system. We take that on proudly. When people need help, they call 911 and we go up and we do the best we can to serve them where they are. This is going to give us even more options to serve this community in a better way. So in 2018, we ran approximately 96,000 calls for service. 77,000 of those calls were EMS. 60,000 of those calls were basic life support, or what we call low acuity. About 40% of that 60,000 calls really were not life-threatening emergencies, and they really needed to be somewhere else. This pilot is going to give us an opportunity to get them to somewhere else. This unit will be staffed with 2 firefighters that are going to receive additional training and additional skill sets that will be partnered with a social worker, that when we go out and we're able to serve people, we're going to listen to them and talk to them. If they have a substance abuse problem, we're going to be able to get them to crisis management. If they need a warm bed to go to, we're going to be able to get them to a shelter. If they need case management, we're going to be able to meet that need. Or as the mayor stated, if they need a 911 response, our firefighters are going to be there to call the appropriate resource. So we're excited to move this forward. The fourth quarter of the year is what we're really moving towards right now when we want to put this unit in service. I can't thank Mayor Durkan enough for her ongoing support of our firefighters and the work that they do each and every day serving the community. Also, special thanks to Councilmember Bagshaw, who has been a champion for this idea since the beginning, and we're excited about continuing to develop new ways to serve this community each and every day. Now I would like to introduce Local 27 President Kenny Stewart.
Well, good morning. My name's Kenny Stewart, and I'm proud to be a 23-year veteran with the Seattle Fire Department, where I currently serve as lieutenant on Ladder 8, and I've got my crew here today with Jeff and Landon Lopez. I'm also honored to serve as president of Seattle Firefighters Union Local 27, representing 1,000 of the best firefighters and paramedics in the country right here in the city of Seattle. And let me start by saying thank you to you, Mayor Durkan, and Councilmember Bagshaw, who's not here today, for your leadership and support of this program. Thank you also to Chief Scoggins, who's been a partner with Local 27 and the rank and file firefighters in responding to these issues in Seattle. And to John Ehrenfeld, who has demonstrated his commitment and many hours of work to make this a reality. Finally, I want to recognize the dedication and service of Seattle firefighters, like those here at Fire Station 10 and across the entire city. The dramatic increase in the workload over the last decade that our firefighters have responded to has taken a toll on firefighters both physically and mentally. I truly believe that this pilot program, Health One, will serve as a model for how cities can effectively respond to our homeless crisis in a comprehensive and integrated manner, combining the training and experience of firefighters with the professional expertise of social workers. You know, the truth is, firefighters have been on the front lines responding to and caring for Seattle's homeless, mentally ill, and drug-addicted population for decades now, 24/7. And with the demands on our fire department at an all-time high, these low acuity responses are overwhelming our resources and reducing our effectiveness. In 2018, almost 42% of our medical responses were non-emergent low acuity calls related to homelessness, mental health, and drug or alcohol issues. But our primary mission as firefighters, what we're specifically trained for, is responding to and mitigating life-threatening emergencies such as structure fires, hazardous materials events, technical rescue incidents, car accidents, and critical medical calls where just a few seconds can mean the difference between life and death. But now, through the Health One pilot program, we can begin to reduce the number of low acuity responses for the fire department, freeing up our firefighters and paramedics so they can respond quickly to these life and death emergencies that happen every single day. Just as importantly, this program will improve our responses to those low acuity calls and those people who need our help by providing the actual interventions and services those folks need. As a 23-year veteran of the Seattle Fire Department, I'm really proud that our fire department is implementing this innovative new program that really gets those folks in the streets and in those the facilities the help that they desperately need. And finally, as a resident of Seattle, where I'm happy to be raising my family, I'm excited because I know that this program will not only make a difference in the lives of those who are living on the streets and in our shelters who desperately need help, but it will also benefit every Seattle resident who wants to live and work in a safe and healthy city. And ultimately, it's going to allow firefighters to focus on what we do best, which is time-critical, true emergencies, and training for them. Seattle firefighters are looking forward to getting to work on the Health One pilot program. Thank you.
Thanks.
See if there's some questions. Yep. I don't know if there's any questions for the chief or for Kenny.
All that
Repeat
will
the question because some people may not have heard it.
absolutely. So the question was, how will we discern on when to send out this unit versus one of our normal units, an engine, ladder, or aid car? All that will be done in our dispatch center on the protocols that our dispatchers have. They'll triage the 911 calls as we do, and based on the information that we receive, we'll make those decisions there. Oh, absolutely. So some of the critical calls are a lot easier to figure out. You know, if someone's calling with chest pain or difficulty breathing, clearly that's a 911 response with the medic unit. A fire or a traffic accident, very clear. But many people call and they say very different things. They may say, I just don't feel good right now, or I'm not in a good place right now, or a lot of other things like that. Our dispatchers have a set of protocols that they'll go through their checkdowns, and after they go through a series of those checkdowns, then they will make a conscious decision. Does this need a 911 lights and siren response, or can Health One respond to them where they are to help them with wherever they are in life?
Chief, you had security going out to some of the calls like this here in the downtown core, extra units, 6 to 8 units responding for security reasons. Are you still doing that? And if so, would you need security for this type of unit as well?
Well, we don't expect to need security for, so the question was, we have added additional personnel to some of our response locations in the downtown area. So the answer to that question is, yes, we are still doing that. We have 4 locations that are a concern for us, and we partnered with Seattle Police Department, thank you to Chief Bess, and we meet up and we go to those response locations. This response will be a little bit different. The dispatchers will take a little longer on the phone to understand where they are. If the person is at one of these locations, they will not be going alone, but this unit could possibly go to one of these locations.
Take a time out just for a sec.
Hey, Chief. And the firefighters on the streets are calling.
Yes, okay.
Hi, Chief. Petition review capability. You got $500,000 in funding. You've got a year-long pilot. When will this actually physically boots on the ground start? And how do you know what metrics are you using to determine whether that's working?
Absolutely. So the question was, we received $500,000 in funding. When will the unit start on the street, and what metrics will we use? So our goal is to put this unit in service the 4th quarter of 2019 with the goal date of October 1st. And I have to give thanks to John Ehrenfeld, who's actually the architect of the program, who's done an amazing job. As this unit hits the street, just like all new programs, it's probably going to take us a few months to find our cruising altitude. But one of the things that we're clearly focusing on are these high utilizing individuals. Are there substance abuse issues? How many people are we taking out of homelessness into shelter? And the other situations that, whether it's addiction to drugs or alcohol, we'll be tracking all of those things for every response that we go on, and we'll be able to look back and see, are we reducing our calls to these individuals. So are we reducing our call load? But more importantly, are we getting people the help that they need so they can transition out of the experiences that they're currently in?
What would you consider success then?
Well, success will be every person that we remove out of an unfortunate situation. If someone's suffering from addiction and we're able to get them to a crisis management center and they're able to get stabilized and transition into housing and to continue on with their lives, that's what success looks like to us. If it's a person living on the street and we get them to shelter for a night because that's what they need, that may be short-term success, but because there's social workers there to receive them and help them, they actually have the ability now to transition out of homelessness. That's important to note also. The other trigger point for this unit going out in the field will be the firefighters. Each and every day we have 200 firefighters out in the field every day, and the firefighters in the downtown core where this will be concentrated during the pilot, they also will have the ability to call for Health One to respond to this location to do the assessment of the person.
Where will the unit be based? Will it be in you driving around as well?
It'll be in one of the downtown stations, but throughout the course of the day, it will be out in the field in the downtown core. Now, our goal is to run this unit during the course of business hours. So if they have a person and they need to get them to an urgent care or a primary care appointment, they're open during business hours. If they need to get them to crisis counseling, they're open during business hours. So the pilot will be through the course of the business day, because most of those type of facilities start to shut down as we transition into the evening hours.
You said it's 2 specially trained firefighters and 1 social worker, is that right?
Yes.
And so a team of 3, and what kind of vehicle is this going to be? Is it an ambulance or a fire truck or just a car? Or?
Well, right now we're going to start off with either an ambulance or one of our Suburbans. That's what we're going to start off with. We're still figuring that out based on what we need to carry. We have both options available to us right now, so we're going to figure out what's the best fit.
And where will that social worker come from? Is that a city employee or someone from a agency, nonprofit?
So we're working through the details there. Right now we currently have a social worker on staff with the Seattle Fire Department, and she comes from ADS, and that's been a great asset to the team. So we may fall back on those existing relationships, because what that will do for us, it will give us a bit of a backstop because they already have a system in play. So if a person needs to take a day off, we can actually backfill and replace them. So we're working through all of those details right now, but we have seen the benefits of our social worker being on staff. Right now what she does is, we go on a 911 emergency, she looks at the high utilizer patients, so she reaches out and does a contact with them, which is very intentional, and try to connect them up with services to help them in the future. And we have seen a reduction in some of the calls to some of these high utilizing individuals. Well,
He doesn't want to say it, I'll say it.
so the answer is no, and that's why we're concentrating in the downtown core.
Look, we're doing this as a pilot, and we're going to look at the metrics very closely to make sure that it will do what we anticipate. But John and others who've been working on this, and Kenny Stewart and firefighters, I believe there's tremendous demand for this. And I think that it will be one of the new urban devices used across this country to respond to those calls that every city that is like Seattle is experiencing right now. And we, again, want to save our firefighters for those things that they're trained to do, to respond to those life-threatening emergencies and not have them tied up in the non-life-threatening emergencies. But that doesn't mean those non-life-threatening emergencies aren't very important and aren't very important for the city to respond to. So my prediction is, and I could be wrong, is we will see that the metrics aren't that it's not successful, but that the demand for it exceeds what we can do in a pilot. And then we will be going to the city council to see how do we scale this out in a way that meets what we need from a healthcare services point. How do we have it connected to all those other things we're doing to make sure that Seattle remains one of those healthy urban environments. But before we had Medic One, people hadn't envisioned how important that is. I mean, look at that right now. Most families at some time have known someone who's had to call Medic One. Seattle was deemed the safest place in America to have a heart attack because of the great response we developed. I think in the new urban environment, what we will see is that we will need some kind of response like this in every part of our city, not just in the downtown core.
And can I just ask, what would be different when this team arrives on the scene? What options will they have? What skills will they have that will be different from when firefighters arrive on the scene right now with this kind of situation?
I'm going to let them address, but the short thing is, when a firefighter arrives, their response in an emergency response is fairly limited. If someone needs health care, you got to put them in an ambulance and you take them to the ER, usually Harborview. One of the most expensive healthcare responses we have. That's what they're limited to. When Health One pulls up, they can determine, does the person really need to go to the ER? Do we need to connect their case manager? Do they need to be connected with housing or social services? They will have all of those options available to them. And most of those low acuity calls, we don't need to keep taking them to Harborview where they aren't getting the services they need. It's very expensive. They're discharged short term later. So, Chief, I don't know if you or Kenny, you want to address more of what that would be, but
one of the key things that we'll have is time. That's very important to really do the proper triage and assessment for someone who is in need of something. Our units today in our 33 fire stations, our motto is built on time, on response times, and getting there and solving problems. This unit will be able to stay on scene with the person as long as it takes to figure out what they need to get them to where they need to be. So time is the key, along with all the other things that the mayor mentioned.
Time for one more question.
So if they're building more because they can spend that time, they'll spend that time to get these folks, whatever resources there might be. My question for you, Mayor, do we have those resources available on the back end for the increase in people that are going to need them?
I think we do. It's one reason why, as we built this out, nothing stands alone. We have to make sure that we build all the infrastructure at once. But we've seen models now where if we have the right people in the field, assessing the person, working with them to determine which door do we need to bring them to in order to get them the services they need, instead of just, we've got to solve this crisis, put them in an ambulance, take them to Harborview, and then you may see that person again in a week or 10 days or 2 weeks. This really is looking at what are those things we can do, that there's a range of healthcare needs. It's not an emergency response, but it still demands a response from the city. I'm very bullish on this, as you can tell. I think that this is a super important step forward. Again, I can't thank the firefighters of Seattle enough. The number of calls that they respond to on a daily basis that are just pure healthcare responses is staggering. And yet every day they show up, do everything they can for the people in Seattle, and I think this will give them another tool to meet those needs. So thank you very much for being here.